Hi, this is Dr. Josh Hustedt. This is a case of a high-risk patient undergoing a knee denervation. This lady is a 70-year-old female who was referred to me after failing conservative management with anti-inflammatories, injections of cortisone and gel, and physical therapy. She had a history of a liver transplant but still had debilitating arthritis. She met with multiple arthroplasty surgeons who told her she was too high risk to undergo a knee replacement, and therefore she was referred to us. She underwent a knee denervation procedure and reports here at her 6-week follow-up appointment.
All right, we have Grace with us today, and Grace is 6 weeks out after a left knee denervation procedure. So Grace, tell us a little bit about how you ended up with a knee denervation, what you'd done before, and how you're doing now.
Okay, I've been through steroids, I've been through gel injections. I wasn't a candidate for a knee replacement, because I have other issues. So Dr. Hustedt was my last resort. I'm doing great. It's my 6th week and I'm doing great. I can walk. The pain is not there anymore.
I'm so happy for you. Yeah, so you have a really interesting story. You had cortisone injections and you have arthritis and gel injections, but you have a history of a liver transplant.
Yes.
And because of that history of a liver transplant, you met with multiple arthroplasty surgeons who said they didn't think that it would be worth the risk to do a total knee replacement.
That's right, because they were afraid of the infection.
Yeah. And
here, when I had my procedure, I only took pain medicine the following day. After that, I didn't take any more.
So one day of pain medication,
the pain, yeah.
And you're doing awesome. And you would say your pain, you were telling me it was a 10 before you came here?
I think I went like 30, and now it's probably maybe a 2, or if any.
Yeah.
I says, but it's really improved life. I'm at 90% right now.
You're doing fantastic. We're so happy for you. You have an amazing story. Thank you for sharing with other people.
No problem.
What would you tell people out there that have knee pain and are struggling with it?
There is hope. There is hope, and I'm really happy I met Dr. Hustedt. I mean, he saved me from all that pain. I couldn't even kneel down at church, and it really helped.
Awesome. Well, go out there and enjoy that new knee.
This case highlights the benefit of knee denervation for at-risk patients. We actually have an article published this month in Plastic and Reconstructive Surgery on surgical knee denervation for the treatment of pain caused by primary osteoarthritis. We conducted this study in non-arthroplasty candidates, which basically means people that presented to our overall orthopedic group, met with arthroplasty surgeons, and were deemed to be too high risk to undergo an arthroplasty procedure. That was usually because they were too high of a BMI, high for hemoglobin A1C with diabetes, too old, too sick, too many comorbidities, like this lady that had a history of a liver transplant. We took these patients and we conducted knee denervation procedures on them and followed them for 2 years. We were able to show a pain reduction on a scale of 1 to 10 from 8.7 to 2.9 that seems to be sustained for 2 years or more. This highlights the real benefit to patients who are at risk. If you're a patient who is high risk or you have a family member who is high risk, please refer them to us for further evaluation for knee denervation procedures. And if you're a provider in our community or around the country, we'd be happy to discuss with you how knee denervation can serve as an adjunct to arthroplasty, both for patients who are high risk, who are non-arthroplasty candidates, as well as for patients who have had total knee replacements and still have residual pain.